This is now the new build that sits as the Royal Hospital for Children Neonatal Unit, which is within the new site of the Queen Elizabeth Hospital in the south of Glasgow. This is a merger of 2 units. It started off as separately, one in York Hill, which was the surgical unit, and then the other unit at the south, which is a maternity neonatal unit. So both of those merged in June 2015. With that came quite a lot of challenges for patients and for staff. And it very quickly became apparent that we were going to need to do something to bridge the gap between the staff and the parents to find a better way of moving forward. So one of the things that we did off the back of that was we established what was then called our communication group. At that point in time, we saw our main role as going to be a way of communicating more effectively between the multidisciplinary team and the nursing staff, and the parents, sorry. And out of that, we put out an invite to the meeting. We anticipated at that time we might get 1, 2, or maybe 3 people show up. And as you can see, we actually filled the room. And it wasn't just nurses and medical staff, it was speech and language, it was physio, it was the infant feeding advisor, it was the lead within the unit, and actually more importantly than that, it was the parents. And it very quickly became apparent that the parents' voice was what was going to shape our progress within that unit and help us on our neonatal journey. So as a starter within that group, we did a parent survey. And from that, we wanted to get a baseline about what the parents thought about their experience of care within the neonatal unit. And some of the feedback you can see from here was really positive. That was nice to hear. There was good, honest information. The staff were great. They were always very, very encouraging. But actually, what negative feedback that's not so easy to hear. That was about the conflicting information that they received. It was about they were told different things on different days. They were allowed to do different things when different staff were on, which is really hard to hear as a neonatal nurse, because I think, especially for everybody in this room, that is really going against the grain of what we're all trying to achieve. So out of that was born our communication boards. And originally we thought that would be something that would be an interface between the multidisciplinary team and the parents, where the staff would maybe update changes in feeds, changes in baby's condition, that sort of thing. But it very quickly became something that was much more personable than that. It became a tool where the parents became a voice for their babies. They would leave instructions or helpful hints to the staff about what babies liked, what they didn't like. The staff would leave feedback, again using the baby's voice. Mummy and Daddy, I've had a great night, I've missed you, I'm looking forward to seeing you. And that became a really powerful thing for parents. Excuse me. Just to highlight one of the boards that really touched a lot of us. This was a member of staff who was looking after a baby whose family were Turkish. She didn't speak Turkish herself, but she used Google Translate to send the baby's voice story back to the mothers. And the feedback from these boards has been overwhelmingly positive. When we implemented them at first, we had to do a lot of staff education. There were some teething problems. We started off with a plain sheet of paper at first. It then was laminated. We lost lots of pens. It then became a different whiteboard, and then became what the board that we've got at the minute. So you can see we started off at a meagerly 10 to 20% use on those boards, but over the course of 5 or 6 months, it very quickly became to around 60% of those boards are used on a daily basis, and that's where we're still at the minute. And you can see from there the positive feedback that those boards are getting. But that was just a very small part of our journey, and it was kind of the starting thing that helped us focus. So from that parent feedback, we got three key themes that were emerging. One was that parents really wanted to be more involved in their baby's care. They felt they were there for long spells during the day. They wanted to do more. They also felt like when they'd held their baby, that was a really good day. They felt connected. When they didn't hold their baby, that had a hugely negative impact on their experience. There was an overwhelming thing about consistency, that not being allowed, or being allowed one day and then not being allowed the next. And off the back of that, the third thing was about education and support. They wanted to be trained more earlier to do the practical things around feeding their baby by tube, around passing NG tubes, the more practical things that were historically a nursing role within the neonatal unit. So we've taken that all on board, and a few of the team were really lucky to go out last year in June to Toronto. We went out to visit Shuley's unit, where they are using family integrated care. And for that, the parents signed up for at least 8 hours, where they were they were giving all the care to their baby. The feedback from that research has been overwhelmingly positive, an increase in the baby's weight gain, huge increase in the breastfeeding rates, and a decrease in parental stress scores. So these things all have an impact on the baby when it's there on the neonatal unit, the relationship with the family in those really critical early days, but actually that then goes way beyond the life of that family on the neonatal unit. So we came back from there full of enthusiasm. The group doubled at that point and so many folk wanted to join in. So we made a vision. Everybody was going to work together as a team. We were going to empower the parents to be the primary caregivers for all babies within the neonatal unit, and that was during the stay on their neonatal unit, in the transition to home, and at the time beyond discharge at home and beyond. So because it was such a huge piece of work, we realised that we had to allocate certain groups so that we could all individually focus and then come together as a bigger group once a month, and that's what we do. So we've got a family education group, a staff education group, there's peer-to-peer support, communication, environments and resources, and we all have our individual remit within that group. So we put these groups up, and at one of our HUGG group meetings we asked the staff, which group would you be willing to be involved in? And this is the feedback that we got. Folk were overwhelmingly willing to go above and beyond. This would be staff that stayed after night shift, it's staff that come in on their days off, it's staff that stay behind after a day shift. And we found that a really good way of communicating our progress when we weren't necessarily all together was using these WhatsApp groups. So we've each got a WhatsApp group. It's much more responsive than email. It's much more personal. So we have these conversations to keep things live as we're going along month to month.
It's so live that they're all texting us or messaging us just now to say good luck this afternoon.
Yeah, absolutely.
That's how live it is.
Yeah, very live. So I don't have time to focus on all of the groups at the minute, but I'm going to talk about one of the groups that I'm particularly involved in, which is the family education group. So that's about, we want to be trained by now, we want to feel confident, and it's about empowering parents to feel like parents from the very first day that that baby's born, no matter how sick or how preterm that baby is born. So we create a programme on a month-to-month basis. It's a rolling programme of daily teaching sessions that take place between 2 and 3. They've got an allocated room where these teaching sessions take place, and they vary from things like transitioning to breast, bathing your baby, comforting your baby, how your baby develops, CPR. There's breakout sessions to look after the parents. One of our lovely nurses, Marnie, does a crafting session. And although these subjects are the kind of core topic for that day, I think it's important that we always tailor to the needs of the parents that are there on that particular day. And actually what they get a lot from these sessions is peer-to-peer support. There's lots of really lovely friendships have developed following on from the family education sessions. So I'm now going to hand you over to Margaret, and she's going to talk to you a bit about the staff education group.
Hi, I'm Margaret Brownell. I'm one of the staff educators in the neonatal group. We have a responsibility today for 173 members of staff, so that's our little education remit. So I was challenged with, I have to look I'm looking at the start from the staff's perspective. So, the parents are saying the rules were different on different days, and it depends on whoever was looking after your baby as to how much information you get and maybe how much you actually got to do at that time. So I wanted to look at that, and then our aims were to empower the staff to support the parents and also to ensure consistency of approach. So we started off, we thought, what will we do? We'll do a survey. It's kind of, if you have the whole talk, it's the kind of running theme. We've all done surveys, we were all surveyed out. So what does family-centred care involved? Care plans updated and developed, parental involvement, education, parents being offered the opportunity to be present in care and other medical interventions, all of the above. Of all the surveys that were handed out, 100% of the staff agreed with everything. So I was like, we've got no work to do. We've got no work to do here. So then we broke it down. So we said, what procedures, activities should parents be involved with? Supporting parents taking their baby out for cuddles, skin to skin. Only 33% of the staff agreed with that, which was a bit, everybody agreed 100% for everything else. So why, when we as a group discussed this and thought it was normal practice, why all of a sudden did only 33 of the staff agreed? So we had to look at that a bit further. So what we done was, over 14 days, each morning a form was given out to each baby, and it had to be completed in that 24-hour period by the 2 members of staff who would be looking after that baby. And the reality was that 76% of the babies actually came out, and 24%, which was actually broken down, was actually 2 babies who there wasn't any opportunity or chance that would have allowed those babies to come out. They didn't miss the chance. Their condition dictated that they would not be able to come out. So on the whole, 76% did, which were a bit up in the air again, thinking, oh, right. So we moved on, and our other kind of, as nurses, the holy grail of the security and sanctity of the ward round and the security and sanctity of the handover were now challenged. So we were thinking, do you think parents should be allowed to stay during nursing handovers? Please select one of the above options. So we were kind of never 19%, 20%, always 29% when possible, but with exceptions, and 21% only in exceptional circumstances. So that was then. Today we have full access. Parents are present for all ward rounds. There hasn't really been any exclusions that we felt it necessary for not to have the parents here. In respect of handover, again, the holy grail of security and sanctity, no, parents are there for handover, but only parents. There's not an extension to grandparents. Other visitors are asked to leave at that point, but parents are present, and now they will contribute, because there's some aspect of the baby's care that the parents know better. So we are now familiar with the parents saying, like maybe at handover a shift to the night staff, they'll say, look, we'll be here, we'll go and get something to eat, but we'll be here for the midnight, we'll do the midnight care, if that's okay. And then even if there's an update in the ward round, the parents are present on the ward round, and some of them will actually now start to present aspects of their baby's care to the medical staff, and then discuss and liaise the ongoing plan forward with the medical staff. So actually we are taking a step back in respect of the ward rounds now. Our role has maybe gone from 90% down to maybe 25-30% now contribution in the ward round. The vast majority, at least 75%, is parental input, and we're tending to find that probably about 65-70% of parents are present daily for the ward round. So that's where we're sitting today. These are sort of the groups, you know, and how the family integrated care. It's a massive step. We are not underestimating it. It's been a lot of hard work. It's been a lot of dedication by a lot of people, and it's been a massive groundswell of change. That, you know, we were actually talking about it at lunch, saying if you had asked us a year ago, you know, would we have thought we would be where we are today? The answer genuinely would have been no, not at all. I don't believe it. But we've listened to the families. We've asked them what they wanted. We've listened to the staff. You know, from the grassroots up, we have changed the culture of the unit, and hopefully we'll prove to everybody you really can do it. You might think that you can't do it, but you truly can do it. And all it takes is, like what I've found as an educator, is work with the willing. Do you know, and as we've gone on, if you work with the willing people, we've found that everybody has had to go on the bus. They are all on the bus now, because they're just getting left behind if they're not, because they can see the movement is away from them. So we've found probably, I could safely say 85% of staff are on board. There will always be the detractors, but 85% of staff are comfortable in working in this environment today. Just going to give Marnie our second to last word. We've got a wee caveat at the end, but
this whole project is actually making me feel much more empowered myself as a nurse. It's the way that I see family-centred care being. It's the way that I want to deliver my care for families, and I'm deliriously happy to be part of it. I am genuinely excited about the future, and I think that this unit could be the gold standard for it.